One word can bring terror into a person's heart: cancer.
In cancer, one develops a primary tumor where cells become undifferentiated, very primitive, so to speak, and they are constantly replicating, proliferating.
Cancer is a multifactorial, multiply caused phenomenon. That cigarette smoking causes cancer. There are 4,000 chemicals in cigarette smoke, including arsenic, cadmium, formaldehyde. These are some of the cancer-causing agents in the cigarette. We know that vitamin and mineral deficiency is linked with increased risk of cancers.
Several viruses have been proven to cause cancers. Environmental causes of cancer are many. And of course, spraying insecticides, I shiver when patients tell me I had my whole house insecticided.
Perhaps these chemicals are not going to kill us instantly like they kill little insects, but instead they're going to cause our demise over an extended period of time.
We now know a lot of the chemicals in the environment, for example, are estrogenic, which in a woman can be a disaster because estrogen, we now know, stimulates breast cancer to grow. Many breast cancers, in fact, cannot grow in the absence of estrogen. They actually require estrogen for their growth and for their own well-being, and if you can think of a tumor in terms of its own well-being.
Artificial sweeteners are molecularly altered sugar and can cause havoc, such as cancers, as proven.
Many of the orthodox researchers will say that you can't really say that a single exposure to some toxic chemical will lead to any type of cancer situation, but we take in 30,000 chemicals a year that are synthetic, and the combination, even in very small doses, can be deadly, and no one can possibly figure out what the synergistic effect of taking in thousands of chemicals, synthetic chemicals, into a body is in terms of cancer progression.
And the only reason why we're still exposed to them, why they haven't been taken off the market, because people are still under this naive belief that if we're exposed to them in such low concentrations, it's not going to hurt us.
Traditional medicine is always looking at a medication to change the symptom or to change the progression of that bad cluster of cells, but rarely ever looks for the underlying cause of illness.
The problem is once we start having cancer or diagnosed with cancer, the treatments are either burning it or giving chemotherapy and surgery. Yet nobody's talking about the core issues that got us here to begin with.
There are very few cancers that respond to chemo and radiation. The cancers that are caught earliest and are removed by surgery have the greatest chance of survival, and that's been known for many years. And the statistics about cancer survival, even with chemo or radiation, are a little bit misleading because they talk about 3-year survival rates. Many patients will survive 3 years without any technique or any therapy for cancers. I have a patient in my practice now who's well into her 80s. She's had a breast cancer for maybe 10 or 15 years. She's never done anything. The cancer's still there, but she's still alive. I think to some extent the chemo and radiation damage the body so much that people become more ill and they can die from the side effects of chemo or radiation or a weak immune response, and the cancers progress because of the damage that's incurred on the body by those techniques.
They lower white blood counts in many cases. They lower platelets. So white blood cells are a part of the immune system. Platelets are needed for blood clotting. And if you lower platelets too much, you can have bleeding episodes, and people sometimes die from bleeding out due to drops in platelets. You get severe infections due to the drop in white blood count. You get nausea, you get vomiting, you have loss of appetite, you get weight loss. You get, not only from the cancer do you get cachexia or wasting of the body, but from the radiation and chemotherapy, you can get those kinds of treatments.
Patients often tell me that the worst thing that they experience is fatigue. And it's not addressed adequately by the system. I mean, if you're going to give people these drugs because you claim you have nothing else to offer, there has to be a fix for the side effects.
What I tell patients when they are trying to make a decision as to what kind of conventional treatment they should do, if any, I say they have to focus on 3 main questions. The first question is, what is my survival value? If I take this treatment, am I likely to live several months longer, several years longer, several days longer, or at all? Am I going to improve my survival chances by taking this treatment as compared to doing nothing? The second question is, what is my quality of life going to be? Am I going to be healthier and happier and feeling better, or am I going to feel worse? And as we know, the severe side effects from radiation and chemotherapy often will have people feeling worse. If there's no improvement in survival value and you're just going to feel worse from quality of life, what's the point of doing the treatment? As I see it, the main treatment is that it's cultural, it's financial, the standard of care. This is how we do it. We don't pay any attention to making people healthy. We pay attention to killing tumors by using these very harsh treatments.